What's up, Everything Medicare Podcast Nation? Hey, this is Christian Brindle, wherever you are and however you might be listening to me today. Thank you so much for taking the time. And folks, this is episode 262 of the Everything Medicare Podcast. Every single week, me and my company bring you a podcast where we discuss your Medicare, your Medicaid, your Social Security, and everything that's got to do with that golden age called retirement. And today, folks, we're going to be talking about really what I anticipate the future of Medicare to be. It's a question that I get asked all the time, so I thought it would be good to kind of do a podcast about it. I've done episodes similar to this over the years, but I felt like it'd be good to do an updated version of that video and that podcast topic. And I thought it'd also be good to kind of, give you some perspective going into 2022 and going forward. So what do we know? Well, what we do know is there's more and more people coming into the Medicare program than ever, right? There's more people aging in. The number used to be 10,000 people a day turning 65. I'll see if I can find the updated number, but I know it's larger than that. Let's say people a day turning 65. Let me just see if I can kind of get an estimate for what that number is. So it doesn't have an exact number, but it's upwards of 10,000 people a day. And by the time 2030 comes, the numbers are going to be astronomical for how many people are actually going to be added to the Medicare system. Actually, it anticipates that so a 2020 census will provide the most up-to-date count of the baby boomer generation, now estimated at 73 million. Wow, that's a lot of people. More than all the numbers I find show that more than 10,000 people a day are turning 65 at this point. And there's just going to be a ton of people entering in the Medicare system. What do we know? Well, what we know at this point is the pendulum has swung more and more towards Medicare Advantage than ever before. The Medicare Advantage program is expanding, right? Every single year it seems like they have more benefits in most areas than they did the year before. There's more funding being put into Medicare Advantage. And why is that? Well, it was explained to me in the last couple of years by someone that was very, very important and influential in the Medicare space. I won't give any names, but that it actually saves the government money for a person to be on a Medicare Advantage plan. That's another reason why you see so much emphasis in it, opposed to original Medicare. So it might sound absurd because we hear numbers that, like, on average, a person's enrollment into a Medicare Advantage plan causes that insurance company to get upwards of $1,000 a month in funding per person, right? We hear all these numbers. It might even be more than that in some parts of the country. So you think, how could that possibly be, right? $12,000 minimum a month per individual enrollment, that's craziness. The reason why something like that exists is because, to me, what that tells me is the government's paying more out in claims than they'd be paying out in funding an insurance company. Now, why is this? Let's dissect this a little bit. What do we know about the government? Well, the government is essentially going to be typically not super efficient, right? Not nearly as efficient and not nearly as good at stretching money and dollars out like an insurance company would, not even close. So, let's just take some numbers out of thin air. Right, and I don't know these numbers to be true from anywhere. I'm just kind of using it as an example to kind of paint a picture in your minds. Let's say that it costs the government an average of $1,800 a month on average to cover people throughout paying claims. This is averaging everybody together. People that are using it around the clock and they're paying out hundreds of thousands of dollars a year in medical bills because Medicare really doesn't have any limit to what they'll pay out, and people that don't use it at all or very little. Average them all together, let's say it's $1,800. Well, let's say an insurance company goes to the government and says, listen, government, we can provide coverage to these people and we can do it better than you, provide more benefits than you, and do it more efficiently than you for $800 a month. You're struggling to do it for $1,800. We can do it for $800 and do it better. How about you give us $1,100 a month in funding, $1,200 a month in funding, so that way we can cover our costs, but also make a profit. You save money overall, on average, in a vacuum on a spreadsheet, and you let that person run their Medicare through us. They'll get drug coverage, they'll get dental, vision, hearing. We'll provide them better Medicare cost sharing than a Medicare Part A and B beneficiary would by themselves. Of course, not with a supplement, but just by itself, it's typically going to be, it's required to be at least as good as Medicare. Medicare Advantage plans are. And the government says, okay, sounds good to us. We got to regulate you, make sure you follow certain rules and regulations, and we have to make sure that you're being compliant, all that stuff, so we're going to keep an eye on you. But yeah, this actually sounds like something that will actually help us out. So that's become a trend, and it saves the government money in a vacuum. If every single person in the United States was on a Medicare Advantage plan, it would save Medicare a lot of money. It would. Hate to break it to you. Now, I'm not saying that Medicare Advantage plans are the way everybody should go. I'm not saying that Medicare supplements are not the way to go. What I'm saying is there's been more and more of a trend and an emphasis placed on Medicare Advantage by our government, by the insurance companies, by everybody, by a lot of people. There's been more money dumped into Medicare Advantage than ever. And what we're finding is over the long haul that we are probably expected to see that trend continue to shift even more and more towards Medicare Advantage. I anticipate over the next 10 years, maybe the next 15 years, things will be only Medicare Advantage, only managed care. And original Medicare might not be a thing anymore. Could be. I feel like that's where things are really shifted towards and where things are headed. Is that a good thing? Is that a bad thing? Who's to say? I think if the Medicare Advantage plans continue to expand and they continue to offer more increased benefits and they continue to dump more funding into it, it could potentially be a good thing. We just don't know enough yet. But I believe that's where the trends are going. Will Medicare supplements just completely fizzle out? I don't know. It's hard to say. I don't have a crystal ball. But I believe that they might be around, but they're just going to become less and less popular as time goes on. We've definitely seen that. There's more people enrolling into Medicare Advantage these days than Medicare Supplement. Anybody that wants to tell you otherwise is lying to you. The data suggests that. The data supports that. And I believe it's going to continue to be an upwards trend of that. It could be good. It could be bad. Hopefully it's a good thing. We always want good things, right? My proposition has always been hope for the best, prepare for the worst. And, I mean, will Medicare Advantage plans look anything like what they do today in 10 years? Probably not. I mean, look at Medicare Advantage plans 10 years ago from today, right? I'm talking to you about this in 2021. Think about Medicare Advantage plans in 2011. They virtually had no dental in a lot of places. Very little glasses, very little hearing coverage. Medicare Part B givebacks, I don't recall them being a thing. I wasn't even in the business 2011. I got in 2014. But Medicare Part B refunds where they put Medicare premiums back into your Social Security check, those weren't really a thing anymore. Those weren't really a thing at that point, excuse me. So the benefits could be just so much richer by then, it might just make no sense to go anywhere but that direction. We'll have to see. But I believe that's where the trend is going. I feel like that's the future of what's going to happen. And it'll be interesting to keep an eye on it and kind of see where things land. Anyway, folks, I'd love to get your opinion on this. If you're watching this on YouTube, if you're watching this episode on YouTube, drop a comment down in the comment sections. Do you agree with me? Do you disagree with me? It's perfectly okay if you disagree with me. I'd love to have a conversation with you. Is there a certain topic you'd like me to cover about Medicare on this show? Please drop that in the comments as well. If you're watching on YouTube, drop a like. It helps so much with the YouTube algorithm. It helps us reach more people just like you who need to hear our information. Make sure to hit the subscribe button, hit the notification bell so you're notified when we upload. If you're listening to us on one of the podcast platforms, please feel free to leave us a 5-star review. It helps us out tremendously. I really appreciate it. And until next time, folks, thanks so much for listening. Enjoy doing these episodes every week. Happy Medicaring.